Okay, why don't we start? Good afternoon, everybody. This is the hormonal and non-hormonal treatment for menopause, Good Hormone Health webinar on March 6, 2016. And we're going to be joined shortly by Dr. Day, we're trying to work on our audio, but we'll have her up in a second. First, I'd like people to relax a moment and get centered and focused. Our hosts tonight are myself, Dr. Theodore Friedman, and Dr. Damian Jones. The female reproductive system consists of the ovaries, which are two of them over here. You can see them on a cross-section. The fallopian tubes, the uterus, the cervix, and the vaginal area. There's a distinct hormonal rhythm throughout the cycle. Estrogen cycle starts low at the beginning of the cycle. It then rises and has a peak around day 13 or so, falls off, and then rises in the second half of the cycle, as in the red. Progesterone is low throughout the cycle, has a somewhat of a small rise around the middle of the cycle, then has a peak around day 21 or day 22 of the cycle. Testosterone also has a mid-cycle peak and is relatively low throughout the cycle, so a little bit more in the second half of the cycle than the first half of the cycle. The beginning part of the cycle is called the follicular stage. You have your ovulation in the middle of the cycle, or somewhere around day 14, and you have your luteal phase in the second half of the cycle. Okay, Dr. Jones, we have you online now. Good?
Yes.
Hi.
Oops.
Feel free to chime in whenever you want.
Okay.
Great. Menopause is defined as the cessation of menses for 1 year. Most women experience menopause between 40 and 58 years of age, with the median age 52. Factors associated with early menopause include lower body weight, menstrual length, having no children, smoking, not using contraceptives, lower socioeconomic status, and race and ethnicity, with minorities, for the most part, having earlier menopause. Higher body weight is associated with later onset of menopause. Some women who transition into menopause have no symptoms at all, but most experience some symptoms, often beginning several years before the last period. The final menstrual period, or FMP, is sort of the guideline of menopause here. You have before that the menopausal transition, which is early and late. It's also called perimenopause, has variable lengths of duration, has variable cycle lengths, is often more than 7 days different from normal, and could include 2 skip cycles or an interview of no periods for 60 days. This is characterized by increasing FSH. Then you have your reproductive area, which is the majority of the life of the woman. It's all stages -3, -4, -5, with early, peak, and late periods. The menstrual cycle, the beginning of a woman's cycling, is often somewhat variable, but it's usually regular during this middle period. And as this period ends, the FSH starts going up. You then have the postmenopausal period over here, which is early and late. You have, by definition, amenorrhea. There's no periods for 1 year, so after the final menstrual period, you're in menopause. After this first year, FSH goes up. It usually lasts about an average of 4 years, and your late postmenopausal is until the end of the life. Hot flashes are also called hot flushes. I think the terms are synonymous. Up to 80% of white menopausal women experience hot flushes. Hot flushes vary by race and ethnicity, with African American and white women reporting more hot flushes, and Chinese and Japanese American women reporting less hot flashes. premenopausal women experiencing surgical menopause have a high rate of hot flashes. Hot flashes can be bothersome to women and can adversely impact quality of life. Treating hot flashes, therefore, can improve quality of life and may also improve sleep and mood. Hot flashes in perimenopause is a very important issue. The 12 most common symptoms of menopause include hot flashes. Hot flashes, number one, night sweats, and I highlight insomnia because I think this is underappreciated, and I'll talk about why that's important on the next slide. But insomnia is a major problem with the menopausal symptoms. Palpitations, depression, anxiety, memory loss, change in cognition, vaginal dryness and thinning, urinary dysfunction, change to sexual response and sexual drive, acne, hair loss, and irregular bleeding. So these, you can see, are quite discomforting for a woman and definitely need to be taken seriously. And I've given some seminars before on how poor sleep is so important for hormonal health. People who sleep less than 7 hours a night are more likely to be overweight, have diabetes, and have the metabolic syndrome. And quality, in addition to quantity of sleep, matters. So menopause leads to poor sleep and may lead somewhat indirectly, but somewhat directly also, to diabetes and obesity.
Yes.
Hot flushes are somewhat poorly understood. The physiology behind them is being studied. There's not a direct correlation between circulating estradiol levels and hot flashes. However, withdrawal of estrogen appears to be necessary for the induction of hot flashes. Increasing evidence supports that hot flashes are due to narrowing of the hypothalamic thermoregulatory set point. That is a point, and I'll show you that on the coming up slide, when you start sweating and when you start shivering. And thus a small increase in core body temperature results in heat dissipation experienced as a hot flash. So you have here this thermoregulatory zone, and a normal person is pretty wide, and you have to get above a high temperature to start sweating, and below a low temperature to start shivering. Women that are going through menopause have a much smaller thermoneutral zone, so that it's easy to go above the sweating threshold and you experience a hot flash up here. It's easy to go below the shivering, and that's why a lot of women feel cold all the time because of this. And this talks about the role of norepinephrine and this norepinephrine product, MHPG, that this goes up when estrogen is withdrawn. You get activation of the alpha-2 adrenergic receptors in the hypothalamus. This reduces the thermoregulatory zone. You have failure of the autonomic reactions to cool the body, and this leads to hot flash or hot flush. And this can be shown here on this slide of effect in the brain at the neuron level here. It seems to have to do with something related between the serotonin alpha receptors, the alpha-1 and the alpha-2 receptor. And this leads to an altered thermoregulatory response in hot flashes and is released somewhat by serotonin. I usually recommend laboratory confirmation of perimenopause. This would include a day 3 FSH and estradiol, and it doesn't have to be exactly day 3. If that's on a weekend, you can get it on a Monday. In general, FSH is between 15 and 30 is consistent with perimenopause, and greater than 30 is consistent with menopause. An estradiol level less than 40 is consistent with perimenopause, and less than 20 is consistent with menopause. But the results vary, and they should be probably repeated and interpreted in the context of the patient. So the person is having a regular period, and just because they have a lab value that's a little bit abnormal, probably should be repeated and should be taken in the context of the whole patient. There's a hormone called anti-Müllerian hormone. Anti-Müllerian hormone is a predictive marker of menopause. An interesting study looked at women 35 to 39. The median time to menopause was 9.9 years if the AMH level was low, and 15 years if the AMH level was high. So a high AMH level is associated with later time to menopause. It can predict a later time to menopause. A higher level of AMH has been found to have a positive correlation with natural fertility in women ages 30 to 44. So therefore, the lower level is associated with lower chances of fertility. And the AMH has the advantage it can be measured any day of the cycle. So I want to talk about this famous study called the Women's Health Initiative. And the background of this is observational studies, which are not double-blind studies. It just looks at women, that women on estrogen had a lower rate of heart disease. These studies came out in the 80s and 90s. I was doing my fellowship at the NIH in the early 90s, and I remember one of my mentors making a comment that if you gave estrogen therapy to postmenopausal women, we may save 1 million women's lives. And this was based on this observational study. So along came the Women's Health Initiative, which is a large prospective clinical trial of postmenopausal women. The ages were 50 to 79. The mean age is 63, so well above what you think about for that you would like to give estrogen to somebody around 50. And it was designed to see whether oral conjugated equine estrogen plus progesterone, which is called Prempro, or oral estrogen, equine estrogens alone, called Premarin, could prevent chronic conditions such as heart disease and dementia. And because they were looking for rates of heart disease and dementia, they wanted to study women that were older than the average age of women that are usually given hormone replacement. The estrogen plus progesterone portion of the trial ended early because of increased incidence of breast cancer. There was also increased chances of risk of blood clots, stroke, and heart disease among the women that received the treatment. The estrogen alone arm in women with hysterectomies showed no detrimental effects, and possible decrease in coronary heart disease when the women ages 50 to 59 were analyzed. So it seems like the estrogen plus progesterone was worse than the estrogen alone. In the study, it did show some benefits of hormone replacement, including prevention of osteoporosis-related fractures and prevention of colon cancer, while the prevention of dementia was mild and not statistically significant, but potential. And it's important to note these findings were applicable only to women taking the medicines Premarin and Provera. And it's thought that certainly after the study came out that oral estrogens affect proteins in the liver that increase clotting. This may lead to some of the detrimental effects seen in the Women's Health Initiative study. These are not seen when estrogen is given by patches or creams. Since the study came out, the use of Premarin and Provera has plummeted, while the use of creams and gels and patches have increased. Many women often, after hearing of these findings in the media that were taken out of context and sensationalized, sought safer treatments, and recently have requested bioidentical hormones, which I'll talk about in a second, from their healthcare providers. Unfortunately, many doctors stop giving hormone replacement altogether and just say the woman should suffer with her symptoms. And I had a patient fairly recently who went to Kaiser sort of begging for estrogen replacement, and she's having horrible hot flashes, and wouldn't give it to her. So I think this is still going on, even somewhat 12 years after the study came out, and it's been shown that around the time of menopause, hormones can be quite helpful. So at the time of menopause, the primary treatment is estrogen therapy. Estrogen therapy has a greater than 80% efficacy in relieving vasomotor symptoms. Prior to the Women's Health Initiative, estrogen therapy was widely advocated, and following the publication of the Women's Health Initiative studies, there was a marked decrease in estrogen use due to concerns of health with estrogen. I frequently prescribe medicine called Estrogel 0.06. It's a cream. I start with 1 pump a day, and I usually give it on the inner arm. Again, I usually use this for perimenopausal and early menopausal women. It can be given any time of the day, but usually in the morning. The main side effects are breast swelling and tenderness. If these occur, the dose can be decreased to half the pump. You can put it on wax paper and cut the pump in half, and then use half for one day and half the next day. And if the hot flashes continue and the estrogen level is low, the estradiol level is low, the dose can be increased up to 2 pumps or even more. Another choice is a patch. There's 2 patches that are generally widely used. One is called Thymera, and it's a large patch given weekly. Vivel is a smaller patch given twice a week. Sometimes they fall off and need to be taped on. And another option is compounded creams as well. I do recommend measuring your estradiol level. This is somewhat controversial among the societies, but I like to aim for an estradiol level between 50 to 100 micrograms per mil. If the patient is still having menses and but is having symptoms of hot flashes, this can be done on approximately day 3 of the cycle. If there's no menses, this can be done on any day. Progesterone replacement is also important. Women with uterus need progesterone is given estrogen. Otherwise, endometrial buildup can occur, and that could lead to endometrial cancer. This can be monitored by a transvaginal ultrasound, which is usually done by a gynecologist, with a cutoff of the endometrial thickness on estrogen replacement of 5 millimeters. If it gets above that, it's concerned that they may need progesterone, and if it's below that, it's pretty safe. Progesterone does help with hot flashes and sleep. However, progesterone can lead to fatigue, so therefore I recommend it being taken at night. It can lead to swelling and bloating and occasional weight gain. I don't give it to all the patients if they don't need it, but it certainly should be given to most patients that are on estrogen. And if the progesterone is given every night, in a continuous manner, no menses should occur. If the progesterone is given for part of a cycle, for example, 10 days, the menses should occur a few days after it stops. I usually give a patient a choice if they want to have a period or not. But in general, I would say women that are less than 45, I usually encourage them to have a period like their age-related peers. While if it's greater than 45, I usually have them not have a period. Prometrium is pure progesterone, is bioidentical. I like the prometrium pills. I'll give 100 milligrams at night if no period is desired, and 200 milligrams for 10 days a month if a period is not desired. You can even give it every 3 to 4 months if you're having side effects on it. Compounded progesterone creams are also an option, but often are not well absorbed. Provera is medroxyprogesterone. It's not bioidentical. I usually don't recommend it just because most women do want something that's bioidentical, although it works reasonably well. I usually don't monitor progesterone levels because you can see whether it's working by whether they're having a period or not. Other treatment for hot flashes, Dr. Day will allude to a little bit, but there's been a strong desire to have other treatments besides estrogen therapy due to safety concerns. The drugs that are commonly used, I'm not going to go over them too much, are the SSRIs, the drugs like Prozac and Zoloft. SNRIs, which are drugs like Wellbutrin and Cymbalta and Effexor, and the medicine gabapentin, which is a medicine originally used for migraines and seizures, but is commonly used for things like headaches and pain. These medicines can have some side effects. They're often quite helpful in hot flashes, and sometimes I use them. The gabapentin is associated with some fatigue, so it should be given at night, and probably some weight gain. These drugs result in about a 60% reduction in hot flashes, and I don't think they work as well as estrogen, and they may have their own set of side effects. So what are bioidentical hormones? Bioidentical hormones are used by compounding pharmacists in the United States or produced by extracting the compound diagenin from plants, usually from high-yield soy and Mexican yams. Although diagenin is structurally similar to steroids, it must be chemically converted into progesterone, which is then used as a precursor to produce bioidentical hormones such as androgens and estrogen. These isomolecular hormones are identical to what's found in women and therefore purported to be better tolerated and more appropriately used to treat menopausal symptoms than traditional hormones. And this was great until the famous Suzanne Summers came about. She wrote several books, including The Sexy Years, Discover the Hormone Connection, The Secret of Fabulous Sex, Great Health and Vitality for Women and Men, Ages, the Naked Truth about Bioidentical Hormones. According to her biography, she's the former star of the hit television program Three's Company, Step by Step, and according again to her biograph on her website, Suzanne is one of the most trusted and respected brand names in the world, representing cosmetics and skincare products, apparel, jewelry, and computerized facial fitness systems, fitness products, and extensive food line. Suzanne received an honorary doctorate of humane letters from National University as a highly sought-after commencement speaker. So if you feel that Suzanne Summers is your expert on bioidentical hormones, go ahead. I think this issue of bioidentical hormones has somewhat unfortunately polarized between conventional doctors and alternative healthcare providers. I consider myself sort of in the middle here. Compounded bioidentical hormones are often made by compounding pharmacies and not pharmaceutical companies. Compounded bioidentical hormones lack well-controlled studies examining the route of administration, pharmacokinetics, and safety, and importantly are not subject to strict FDA approval process required by conventional medications. Thus, the use of bioidentical compounds has polarized the medical community, with conventional doctors and mainstream medical organizations being, for the most part, opposed to compounded hormones, while alternative healthcare providers and clientele are, for the most part, distrusting of conventional hormone replacement in favor of compounded hormones. And I think there's a big business of bioidentical hormones. This was in the Los Angeles Times, that you can go to this Beverly Hills site here. That's an advanced cosmetic and wellness center, and get your bioidentical hormone replacement therapy, while you also get facial contouring, facial rejuvenation, and body contouring. And according to its advocates, there's a strong case for bioidentical hormones. I just want to walk you through a little bit of what some of the advocates say. Again, I'm sort of in the middle of this debate here. One person says Premarin is horse urine, horse estrogen. It contains echolin and two other forms of estrogen found exclusively in horses. It's derived from pregnant mare urine, hence its brand name. Premarin works great in female horses, just as Chevy's parts works great in Chevy. Premarin is as foreign as any synthetic drug because the body lacks the enzymes and cofactors and metabolites and safety. Premarin was a huge moneymaker for its manufacturer, Wyethurst. However, its first use has dramatically declined. And the body makes estriol, estrone, and estradiol in a ratio of 90 to 3 to 7, while Premarin contains mostly estrone, which can lead to breast cancer, equilin, and estradiol, and other conjugated estrogens that are not in what the body makes. Estradiol may antagonize some of the proliferating effects of estrone and estradiol, while having less effects to stimulate endometrium proliferation. There's some of the bioidentical hormone advocates in favor of estriol, while estrone has some detrimental effects on the liver. It's probably not recommended. The alternative doctors and the compounding pharmacies think natural progesterone has benefits over synthetic progesterone. Conventional doctors prescribe progesterone-like drug, or progestin called Provera, and natural progestin such as the prometrium or compounded affords the same protection against endometrial cancer as synthetic progestin, does not interfere with estrogen's ability to protect against heart disease. The case against bioidentical hormones has come out by both the Endocrine Society and the American College of Obstetricians and Gynecologists, and they issued position statements against compounded bioidentical hormones. And the FDA has submitted a press release warning 7 pharmacy operations that claims they make about safety and efficacy of their bioidentical hormone replacement are unsupported by medical evidence, are considered false and misleading by the agency. So my take is I do try to use what are bioidentical estrogens and progesterones, which is estradiol and progesterone. And again, the products I mentioned are all bioidentical because they are estradiol and progesterone. And I think both from pharmaceutical companies and compounding pharmacies have pluses and minuses. Both can be used. And somewhat I leave it up to the patient. The prescription ones are quite good and quite safe. I usually start with them, but often I use the compounded ones as well. I want to mention a very important study and another drug that's not widely used for hot flashes. It's a supplement, and that's vitamin E. So this study that was fairly recently published enrolled 51 patients to receive either placebo for 4 weeks, then a washout period, and then 400 international units of vitamin E for the next 4 weeks. And it was a crossover type of design. The patients that received the vitamin E had much lower scores in hot flash severity and lower frequency of hot flashes compared to the placebo treatment. That was highly statistically significant. And based on this trial, vitamin E at 400 units a day is recommended for the treatment of hot flashes. It has little side effects and may help prevent or treat fatty liver disease, which is quite common in patients that are overweight, and probably growth hormone deficiency in Cushing's patients. So vitamin E is another alternative for treatment. Okay, I'm going to pass the baton over to Dr. Day, and she'll talk from here.
Okay.
Let me do the ball. I'll keep the ball.
Okay. So welcome everyone, and thank you so much, very much, Dr. Friedman, for giving us that background. So obviously you can see that I started with what can you do to balance your hormones, because we talked about in the very beginning how the body normally works. And one of the first things that I always recommend to patients is that get your regular medical checkup so that you actually can ask the questions and find out, are these symptoms related to your hormones? Are they related to another illness or disease, so that you're actually treating the right thing? So I always want people to have an understanding of what's going on in their bodies so they can work with me, or you can work with your doctor to actually find the solution. So we talked a lot about hot flashes, and I have to be honest that the number one thing that I've used to help reduce hot flashes is the foods that people eat. And the reason why I say that is because hot flashes can be exacerbated by different types of food. So we're going to talk a little bit about the different foods and how that impacts people's hot flashes and their menstrual cycle and some of the other symptoms that we talked about when we were talking about those hormonal treatments. So I think that that's really important. And then movement, I say movement instead of exercise, because movement can show up in lots of different ways. And when I think of exercise, I think of the gym. But there's definitely, when you move your body, that actually can have a positive impact on some of the symptoms that are associated with menopause and premenopause. So we'll talk a little bit about that. We'll talk about sleep. And one of the interesting things that Dr. Friedman already brought up is that some of the symptoms that are associated with perimenopause and menopause prevent people from being able to sleep, but sleep is one of the solutions that I have. So it's a kind of interesting balance of how you can get people to sleep and reduce their hot flashes if that's one of the problems, or night sweats that they may be having at the same time. And then we'll talk about stress management, because literally I'm going to talk a little bit about some of the hormones that we didn't talk about that actually impact women's hormonal systems. And then we'll do a little bit on some supplements that may also be helpful. So we go to the next slide, please. So before I start talking about high fiber food, I want to actually talk about something that I see a lot in my practice. And I just want to explain a little bit about the physiology of the body. And this also relates to stress. So our body, what happens is we have a backbone, and our body has to decide in terms of hormones whether it's going to shift into your female hormones or shift into your stress hormones. And under normal circumstances, the body doesn't have to choose between one or the other. But if we've really been very stressed, for example, and I'm here in Washington, D.C., and people are very stressed in Washington, D.C. So sometimes if you've been really stressed for a long time.
Stressed about the presidential candidates?
Yeah, not just them, but, you know, us having to listen to all the stuff that they do can stress us out too. But sometimes when you have a very busy life, and Americans seriously actually do have quite busy lives, and we kind of press on the gas for over and over and over again. And when we do that, we actually start to deplete some of the cofactors that we need in order for our body to produce stress hormones. And so cortisol being the major one that I am thinking about. So you have these things, your adrenal glands, and they produce your stress hormones. And when you start to deplete that system, the body actually sometimes begins to have to make a choice between producing your stress hormones and producing your female hormones because they come from the same backbone. Now, if it has to make that choice, we know as women that we don't have a period until we go into puberty, and then we don't have a period when we are hit menopause. So as a result, that our body can live without producing female hormones. It cannot live without producing our stress hormones that are created from our adrenal glands. So when we tax the body and we don't give the body the right nutrients and the right food that it needs, sometimes it has to make that choice. And so what I find, particularly in perimenopausal women, that when I start treating them and I give them the nutrients and the supplements that they need, and I talk to them about what they need to eat, and we start making those changes and start supporting the adrenal glands, actually their female hormones start to go back to normal. And the way that that shows up is that the hot flashes begin to subside. Their sleep begins to improve. And all of that really comes from treating the adrenal glands. And so it's a very important part of my evaluation when I'm working with women who are experiencing perimenopause and menopausal symptoms, because sometimes it's actually not the female hormones, right? So I'm not automatically going to give them estrogen or progesterone. Sometimes I just support the adrenal glands, and as a result of supporting the adrenal glands, they actually go back to a more normal period, or their symptoms from perimenopause actually decrease. And that's a huge thing. So food is very important, and making sure that you're taking the right supplements or the right medication is very important, which is why the very first line item I said is check with your medical professional so they can actually check and see what's going on. So that being said, things like I've had patients that come in and they drink 3 or 4 glasses of coffee every single day, and just taking them off of the coffee can reduce their hot flashes. I have people that eat a lot of processed food and junk food, and they're not eating whole foods, and by changing from junk foods to whole foods, their hot flashes can be reduced. So it is really important that food can be your medicine. And so I'm going to start with this idea of a high-fiber whole food diet is one of the things that is really important and that could really change people's symptoms. It may not eliminate their symptoms, but it definitely can reduce their symptoms. So we want people to make sure that they look at and eat a really good balance of proteins, carbohydrates, and fats. These are considered whole foods. So whole foods are foods that are found in their natural state. They're foods that don't have chemicals and additives as part of the food that they're eating. I sometimes say that whole foods are foods that your grandmother ate. So if your grandmother ate it, it's probably much closer to a whole food than if it came in a box, right? If it came from a tree, if it came from the ground, if it, it mooed, had 4 legs, or it swam in the ocean, those are all examples of whole foods. And those foods tend to have lots of nutrients. They have things like vitamin E and vitamin C, and they have other nutrients like magnesium, for example, calcium. It has these other things that we're going to talk about a little bit later that actually empower our bodies to actually normalize and get rid of symptoms. So let's go to the next slide. So one of the most important things about a high fiber diet, so you want to eat whole foods. Fiber is only found in plant-based foods. So fruits, vegetables, nuts, seeds, beans, legumes, all of these things are, go ahead. Oh, okay. I thought you were going to say something. Did you say something?
No, I think just someone came in or came out.
Oh, okay. So, so you want to make sure that you have plant-based foods, because fruits and vegetables have not only fiber, but they have some of the nutrients we talked about: vitamin E, vitamin C, magnesium, calcium, omega-3 fatty acids. So they have these phytonutrients, these plant-based nutrients that our bodies need, and that helps to regulate that balance that I was talking about before, and can help reduce symptoms of hot flashes, night sweats, cramping. You know, some of those are some of the symptoms. Heavy bleeding, some of those symptoms that women have. Inflammation, it can reduce inflammation. So these are all very, very important, and they can be found in the food that we eat. So even before we get any prescriptions, the first prescription is eating a healthy whole foods diet. When we eat fruits and vegetables, those actually have lots of fiber, lots of phytonutrients, and you'll notice when you look at the picture, you see multiple different colors. You see colors of the rainbow. And if you eat colors of the rainbow, then you're going to be making sure that you're getting a variety of these different phytonutrients that we need. Next slide.
Looks good.
It does. So one of the things that I mentioned that was a whole food was beans and legumes. So soy products are considered plant-based. They're considered a protein. They're considered a whole food. And what has been shown to be helpful is the isoflavones that are found in soy products can help to balance hormone levels. And the reason why is chemically they are similar, not exact, but similar to the estrogens that we were talking about, that you look for bioidentical, or if you're looking for, even if you're getting a medical based estrogen. So these foods have they weakly bind to the receptors on our cells, and so they start to give some of that relief. They do not tightly bind, they do not exactly bind, they do not give the exact same response that you would get if you had an estrogen molecule that was created from our body or a bioidentical. So it's very important to know that, because I've worked with lots of breast cancer patients, and they are concerned about the idea of, if they take in soy, is it going to cause a disease, as opposed to help them feel better and feel well. And what I have to say about our body is our bodies are very specific. Our receptors are very specific. So if you have something that's weakly binding, it's not going to produce the same activity in the body as one that is able to actually tightly bind. So it is important to do that. And then what I also tell those patients that are concerned about soy products or cancer is, it's better to just take something out of your diet than it is to eat it and be concerned about it, because it creates a level of stress that you absolutely do not need. The last thing I'm going to say about soy products is that it's better to eat soy as a food than it is to take it as a supplement. And we also don't want products to be overly processed. So eating edamame, which is the if you see at the bottom of the screen, like where it looks green, like it's come out of the ground, that's edamame. And I would recommend edamame as your first choice before you start having things like soy milk, which has actually been very processed. So those are the kinds of things that I recommend about soy products. Next slide. So the first thing I talked about is food and whole foods. Now, just to recap about the whole foods before we go to sleep, is that when you're eating a whole food diet, your aim should be to get 10 servings of fruits and vegetables every day. And I'll talk to you a little bit later about how you can do that. And that you, so that's where we were. You want to get 10 servings of fruits and vegetables every day. You want to eat whole foods. So if you are eating poultry or fish or dairy, you want to eat wild or grass-fed or things, again, that are eating their most natural foods, because that means when it comes into our bodies, it's actually going to be the most natural state. So in summing up the foods that we eat, that's what we want to look for. Then the next thing that we want to talk about is sleep. So, and then from an avoidance perspective, I just want to say this too, that avoiding things like alcohol, avoiding things like highly caffeinated products, avoiding things like very sugary products can also reduce the amount of hot flashes that you have. So that would be my first step. Then when you think about sleep, one of the things that I recommend to people is to create good sleep rituals or good sleep hygiene. So that means every night go to bed at the same time. Prepare your body to be relaxed. So that might mean taking a bath, or maybe you're taking a shower, maybe you're reading for 15 minutes, maybe you're doing breathing or yoga, but you're actually like slowing yourself down and preparing your body for sleep. We also, part of good sleep hygiene is to make sure when you are in your bedroom that it's as dark as possible, because the hormone melatonin operates when it's dark. It does not operate when it's light, which means don't play on your phone or your iPad or have your television on for, hours before you go to sleep. Turn it off an hour at least before you go to bed and start unwinding, because the light that you have goes into the cones and the rods of your eyes, and then your brain actually says, oh, it's not time to produce melatonin yet because it's not dark enough. So you need to let the electronic equipment go, slow down, do things that are relaxing to get ready for sleep. And when you do that, it'll often help you to sleep better. If you can go to bed before 12 o'clock and sleep into the morning, you want to get at least 7 or 8 hours of sleep. That actually can help you, because when you're tired and you're irritable, you're not as focused, you're not as concentrated on what you're doing, you're tired and you're fatigued, and those things can make any hormonal symptom that you have feel worse, and we don't want that. So getting restorative sleep is important, and it also repairs your body. And like I said earlier, it restores things like your adrenal glands and your other hormones in your body, and it reduces insulin resistance. There are new studies that show when people get poor sleep, they get less than 6 hours of sleep, and this happens on a regular basis, it increases the insulin resistance that's showing up in your body, which can lead not only to obesity, but to diabetes, and metabolic syndrome. So sleeping is really important so that you're not exacerbating other disease processes when we're talking about getting healthy.
I would say people need at least 7 hours of sleep.
At least 7 hours of sleep. You heard it from Dr. Friedman.
Right.
At least.
And when you have the hot flashes, your quality of sleep is poor, so it's almost like a circle going on. But try your best to go to bed early and get good quality sleep and get rid of those electronics.
And yeah, so you definitely want to do those. And the other thing I've noticed, like I talked about before, is I'll give adrenal support to patients to help them get to sleep. And one of the first things I notice is their sleep improves, and then over time their energy level improves. So again, there is that the body has to make a choice between the stress hormones and the female hormones. We don't want them to be making those, having to make those kind of choices. So supporting the adrenal system often helps with sleep a lot, is what I've noticed in my practice. So next slide, stress management. So stress management is really important because, again, like I was talking about before, when you're revving the engine and you're using all of your resources, like your vitamin C, your magnesium, and you're using all those resources, you're not able to use them to help rebuild your stress hormones. and so that you can use them effectively and efficiently when you actually need them. So stress management can show up in lots of different ways. Laughing. I wake up in the morning and I will watch a YouTube video or a comedy video while I'm getting dressed in the morning, because it's important to me to laugh in the beginning of the day even before I get into my day. So I actually think that making laughter is a very important part of your daily activities. It helps you live longer, and it helps you enjoy the quality of your life while you're living it. I also really think it's important to just take a moment to center and to have some quiet time every day. It can be in your car, it can be in your office, it can be in your home, it can be taking a walk in nature, but to give yourself some quiet time to really feel centered in yourself will make a big difference in the way that you operate and a big difference in the way that you make decisions about your health and the health of those that you love. So other examples might be taking a bath or lighting candles or doing activities with your friends, connecting with your spiritual source. All of those things are important and should not be diminished just because you have a lot of things to do, because you will always have a lot of things to do. You will never get everything on your to-do list done. It'll never happen. Because the nature of human beings is if we finish everything on our to-do list, we're going to create a bigger dream and a bigger project, and we're going to put more things on our to-do list. So just keep that in mind when you're actually trying to decide how much time you have in a day. Okay. So I'm going to talk a little bit about supplements. Now, supplements are not, I don't use supplements until after I've worked with people on their diet. We didn't talk a little bit, very much about exercise, but I will say this. Exercise is very important. I call it movement. And one of the reasons why it's important is that just moving your body every day helps you to do things like not be overweight. So why do we care about that? Well, when you actually are overweight, adipose tissue actually releases estrogen. So when we're talking about this balance of estrogen and progesterone that Dr. Friedman was talking about, when you have extra weight, when you're overweight or you're obese, your fat cells are actually producing estrogen as well, and it throws off the balance, which causes hot flashes, night sweats, insomnia. So it's very important to make sure that you're maintaining a healthy weight, because that usually tends to reduce the intensity of the symptoms that you receive during premenopause and menopause. So that's important. Also, by exercising, it also helps you to eliminate every day. So when you eliminate, you're actually getting rid of toxins. And when you eat high fiber foods, what will happen is the fiber will bind with cholesterol and to pull it out of the body. It will also help conjugate the estrogen so that they go into the body, to the intestines, and once they go into the intestines, they bind and they get pulled out of the body. So again, we don't want our estrogens to recirculate. And once we put them into our intestines to get them out of our body, if we're not moving our bowels every day, estrogen can get reabsorbed. And again, Dr. Friedman laid it out in the very beginning that we have estrogen levels and progesterone levels, and they should be within a certain ratio. When they're not within that certain ratio, it causes symptoms. So movement is really important because it helps to make sure that you're eliminating your toxins by pulling them out of your body, or you're sweating, so they're coming out through the skin. you're actually breathing, and every time you exhale, you're releasing toxins. So all that helps to make sure that your symptoms are not being exacerbated. So movement is very, very important for that. And then for people who enjoy a healthy sex life, and your sex life is going to change as you go through perimenopause and menopause, that exercise improves your sex drive as well. So it helps to, again, balance some of those symptoms that begin to go through the change as women go through perimenopause and menopause. So exercise is important, eating correctly is important. Then the other thing that I do is I actually do hormonal panels for women to make sure to see where their hormone levels are. And then supplements come in around the same time that I offer the bioidenticals, which I also do in my practice. These are some of the supplements that I use for patients and to help not only with symptoms, but also with just improving the overall body support. So magnesium is the first one. And magnesium, sometimes if women have difficulty falling asleep or staying asleep, magnesium can be really helpful to help women with sleep. So since that seems to be a big symptom, magnesium works really well for that. I also use L-theanine with patients, and that actually works really well. And sometimes they have to use a combination of the two to get women to sleep. So I'll use that. Magnesium is also really helpful if women are having cramping symptoms, either from their periods, or they may not even have their period any longer, but they still may have symptoms of cramping or feeling uncomfortable around the time of when their period was, when they are going through perimenopause. And so magnesium can help with that as well. The next group.
To rush you. I think we should maybe 2 or 3 more minutes, and we'll leave some time for questions.
Okay. So flaxseed oil and evening primrose oil, I actually use those in combination with the moon cycle. We don't have time to talk about that really right now, but I do that, and that sometimes helps in perimenopause to help regulate people's periods amazingly, just using those 2 products. B vitamins I also use quite a bit to help with mood symptoms of irritability. Sometimes B vitamins are considered the happy vitamins. Really what they are is they are precursors for a lot of our nervous system, and so it's really helpful to use those to kind of help with those symptoms. So those are the supplements that I use, and those are why I use them. And then I just want to say that I really appreciate you allowing me to come and talk about some of the natural symptoms, the natural methods that I use to help reduce symptoms. And again, I use bioidenticals as well, but I use them in combination with all the other things that I talked about today. Yep, I went through all those.
Okay. Want to talk about your Juice Plus for a second?
Sure. So again, in eating appropriately, I like to use Juice Plus as instead of a multivitamin, I use Juice Plus because it's 33 different fruits and vegetables that people can take in a capsulated form. So if they're not getting their 9 to 13 servings of fruits and vegetables every day, this is actually a wonderful product that has helped a lot of my patients, and I put all of my menopausal symptoms on it. And then the next slide, I think, just shows that I'm doing an online course. It's called Kitchen Magic, 6 Weeks to Healthy Cooking Basics, where I send video links about the stuff that we talked about today, like whole foods, I do a grocery store tour, I do pantry items, I talk about herbs and spices. And so there's a lot of different topics that I show you how to walk through during the 6-week period of time, and that includes whole food recipes. So I do recipes in the kitchen as well as education like we've been doing today. And if anyone's interested in that, I think we're going to send you a link when we send this. So if you have any questions for us, then please feel free to just ask away.
Great, thank you.
Yeah.
Excellent. So with questions, use the chat button. Keep the questions related to the topic, one person until everybody asks one, and try to keep them general and not personal. Pull up the chat button. We start from Adina. Hi, Adina. How are you? How would one know if they're having hot flashes, etc.? How would they distinguish that from just feeling hot sometimes? So I think hot flashes in general, it's sort of a gradient from being hot. And as I mentioned, you have this thermoregulatory window that is narrower in a menopausal, perimenopausal women, that they feel hot more than somebody younger or male does. And that's the first thing that starts, is they start feeling hot and they're sweaty. And then as it goes on, they get these rushes of feeling hot that occur mostly at night. They last, maybe about 15 minutes. Their face gets warm. They feel miserable. That's a true hot flash or hot flush. So it's a gradient between feeling warm to a full-fledged hot flash, and most women in perimenopause or menopause really do get the full-fledged hot flashes.
So if you're noticing that you're starting to feel warm at different points during the day, that you might be kind of leading into that, so that would be a good time to talk to your doctor to see about, cutting them off before they actually become full-fledged hot flashes.
Kelly asked, what is the cutoff for caffeine? You want to answer that, Dr. Day?
If you're actually using a lot of caffeine, then you probably need adrenal support or some other types of support. So I am not a big fan of using caffeine for energy.
Yeah.
Yeah.
Sorry for cutting you off.
That's okay.
So if you're drinking a lot of caffeine, there's probably something wrong that you need assessment. But I think certainly most people can have 1 cup of coffee in the morning.
1 cup of coffee. But
if you're drinking caffeine throughout the day, probably not the best. Pat is asking, I became surgically menopausal at the age of 42. Over 10 years, I experienced night sweats multiple times. My diet is good. I take magnesium. I will try vitamin E. Do you have any suggestions for this problem, adrenal support? So again, I think I would agree with what Dr. Day says. Start eating well, exercising. But, I think you could consider going on estrogen. So you're 52. You're still sort of in the window that people often benefit from estrogen. I don't think I was clear on this. I'm sorry. But in general, I think estrogens are beneficial for women, certainly around 50 and probably up till 60. And the patients that get the surgical menopause usually do worse and may need estrogens longer. So I think you can consider going on estrogen. Either you can start with the vitamin E, but I think you'd be a reasonable candidate for estrogen.
Yeah.
She has hypothyroidism and low aldosterone. I think getting your thyroid balance and getting your blood pressure proper, not too low or too high is bad. Adina says, okay, good, that never happens to me. Excellent. Kelly says, I drink all day coffee and tea. I can still sleep. I think one of the problems I have my patient experience with caffeine is it's like a roller coaster. You drink some caffeine, you get high, you get happy, you get some energy, and it wears off in a half hour, and then you feel tired again. So even if somebody can sleep okay, I still think that too much caffeine is probably not the best for you. So I would probably, just do it in moderation.
So again, if people are drinking coffee or caffeine all day because they feel like they need to do it during the day, that's a problem. It doesn't matter if you sleep or not. Really, all you're saying is you're exhausted, you're pushing yourself all day, and then at night you can still sleep. And that's because your body needs the rest. If you're doing it just because you like the taste or there are other reasons why you're doing it, then that's different. But if you can't get through the day without doing caffeine all day, then your body is depleted and needs more nutrients. Now, whether it's a nutritional test that you take to find out what nutrients are not there, if there's some other problem like a thyroid problem, you have to kind of look into that and see what's going on. But if you have to do it all day in order to get through the day, you need to work with your doctor to find out why you're so exhausted all the time.
Well, Sharon has a great question. I have a great answer for her. If you're not currently perimenopausal or menopausal, what would you recommend more or less in preparation for the change? First of all, say your prayers that you're not there yet and enjoy it while you can. But I think, try to eat healthy, get yourself as, into good shape, eating the natural foods, Get plenty of sleep, get yourself trained for good sleep, you know, with what Dr. Day said about not staying up too late and having regular cycles. And then when you hit it, you'll hit it with a head start.
Yeah, so, you know, for me, for example, I had irregular periods when I was a teenager, and since I was 20-something, I haven't had any issues. Like, I don't have any problems. I don't even know my period is coming except for looking at the calendar. And that's not true of most of my patients, and it's because I focus on all the things that I shared with you today, that I don't have any of those symptoms. So people that generally that don't have many symptoms, they don't tend to have really bad symptoms in perimenopause and menopause. So the more you focus on just leading a healthy and a high quality life, the more likely that your symptoms will be less when you actually get into the stage of menopause and perimenopause. There's certain traditional cultures that actually don't even have words for menopause, because they are, you know, not as plugged in as we are. They lead more traditional lives like people did 100 years ago, and they don't have the same types of symptoms that we have as a first world country. So it says a lot for what diet and exercise can do to reduce those symptoms for perimenopause and menopause.
So Adina makes a good comment. Women who have low estrogen symptoms but have hypothyroidism in general have low estrogen. You know, you can eat healthy and take some supplements, but you're still probably going to have low estrogen. You might deal with your symptoms better, but you know, if you have low estrogen from either pituitary problems or surgical menopause, most of the time you'll need estrogen.
Yeah.
I think you know what we're talking about is in parallel, but I think Adina is completely correct.
Yes.
Especially if their LH and FSH is 0, correct. Other questions? Thank you, Pat. Okay. Very nice seminar. Thank you, Dr. Day, for joining us tonight. Thanks, everybody, for joining us.
Thank you.
Adina asks, can I take estrogen forever? Forever is a long time. You know, so in general, and this is a big generalization, I usually think about stopping estrogen at 60. There are patients that keep on longer. I think there's some sort of a shift even to use it a little bit longer. But at least assess whether it's still needed or not. Usually, as the years after menopause go more, the symptoms of menopause are less. Your body gets sort of used to it, and you can often get off of it at 60. There's a thought that there's this window of time until 60 that they're beneficial, and then after that they may lead to the increased blood clots and cancers and strokes and heart disease that we're seeing in the Women's Health Initiative in some women in their 60s, but other women do okay in that. Sharon asks, if you have other hormonal problems, will menopause be more difficult? And I would say there's a good chance it will be, because, you know, you're sort of off balance as it is.
Yep.
You know, I think even somebody, you know, even if you have an excellent replacement, if you have your pituitary damage from prior surgery or something of that nature, you know, if you have hyperpituitarism from a small pituitary, your hormones just aren't as good as they were under natural circumstances, and then menopause will be harder.
Yeah, so menopause is a stress that happens on the body, and so are any disease processes. And the more stress you put on your body, the more difficult it is for your body to be able to handle all of those things. So the more you can remove that stress, which is what we were talking about in terms of solutions, the easier it is for your body to actually stay in balance, and that's what we want.
So Adina asked another good question about how do you know in a person with hypopituitarism if your body goes into menopause? Well, first of all, it's going to be not the major change, because someone like Adina has low estrogen and she will have low estrogen. It is possible her FSH may rise a little bit if, you know, when her ovaries stop working, and, you know, she is on estrogen and progesterone replacement that is regulating her cycle. So it might be a little hard to do that. But, you know, I think at a certain age we'll sort of conclude that she is in in menopause. Kelly asks, is it just individual difference if someone has more of the other symptoms than the hot flash? Yes, the hot flashes, but the other things were much more of a problem. So yeah, I think, different people have different reactions to the menopause and the low estrogen. Hot flashes is the most common symptom and maybe the most detrimental, but a lot of those other symptoms on the list we showed are also part and parcel of the whole transition period, and some people may have more or less of them. Adina wants the fountain of youth. She wants to trick her body to stay young forever. I remember in high school I read this book, The Picture of Dorian Gray, that he makes a deal with, I guess it was the devil or something like that he was supposed to stay young forever and his picture would turn old, but I don't think it's worth it. I'm sorry. I think everybody does get older, but you have to figure out how to age gracefully.
Yeah, so when people say that they want to trick their body forever, our body is not really meant to last forever. And I think that we have to get away from this idea that youth is beautiful and not being young is not. There's some really wonderful things about getting older and getting smarter and getting wiser that we have to kind of think about too. And it's just a combination of just kind of thinking differently. Again, I know I'm in Washington, D.C. I know it's different out there in L.A. In terms of all the pictures that you're given about, what's beautiful. I think it's really important to have a good self-esteem and self-image around, every age. Things change for us, and that's just a normal part of life. Death is a normal part of life, actually. We just want our life to be as fantastic as it can be while we're here.
And it's healthy.
Yeah, and it's healthy.
Okay, we'll take, maybe we'll do just 2 more questions here. Kelly says, Kara says, if I hit surgical menopause at 40, is estrogen still a good solution for me? And I take it for 20 years? I would say yes. So I think, again, the people that have surgical menopause are often more symptomatic than somebody has a natural menopause, and they probably need estrogen and can probably take it till 60 is reasonable. If somebody has been on estrogen, should have been on estrogen, looked postmenopausal but couldn't get it, they're prescribed for a long time, and they don't respond differently to treatment. So again, as you get postmenopausal for many years, you get used to it, and you need less treatment, and you can often don't need treatment. If you still have your symptoms, then you can get it, and you should respond. But I would say as the years go by, maybe less treatment. Adina says, getting wiser is extraordinarily beautiful. I agree. Adina's both wise and beautiful. So she gets both credits for that, but not getting tired and weak. So hopefully we'll be working on that. I think she is getting better even for that. Okay, so let's call it a night. Thank you, Dr. Day. Thanks, everyone, for joining. I will post this the next couple of days. Thanks, everybody.
Take care.
Bye-bye.
Bye.